physical therapist assistant.
And I'm Libby, physical therapist. We're here at Canyon Physical Therapy and Aquatic Rehabilitation today to look at pregnancy-related low back pain.
As you may know, there are a lot of changes going on in your body during pregnancy. Your body releases the hormone relaxin to increase joint laxity preparing for birth. Combined with increased weight gain, this can cause pregnancy-related low back pain.
Today we want to look at lumbar mobility exercises that are specifically safe and appropriate for pregnancy. When in pain, we tend to limit movement to avoid it. These exercises will promote pain-free mobility, which will improve blood flow, increase stretch and compression of the ligaments, tendons, and cartilage, improve your disc health, decrease inflammation, and improve your pain. While you may feel stretched during these exercises, they should not be painful. If you do have pain, decrease your intensity, and if your pain persists, consult your physical therapist before continuing.
It is also important to note, as you progress in your pregnancy, it may become uncomfortable to lie on your back. You may experience shortness of breath or numbness going down your legs. Just remember, with any of these exercises, you can perform them in the seated or in the reclined positions. Another common pain complaint during pregnancy is round ligament pain. This can feel like a sharp shooting pain in your side when you move too fast, when you get up from lying down to sitting too fast. Today we're going to go over some techniques on how to go from the sitting to the lying down on your back position while preventing that pain using the log roll technique.
So to do the log roll technique, Ashley's going to start sitting on the side of the table, and she's going to lower down onto her elbow, keeping her back in a nice neutral position. Slide her feet up onto the table so her legs are supported, and then lower her head down to the pillow. Now, as a whole unit, she's going to rotate from her knees to her back, onto her back, and then adjust her hips back to the center of the table. This reduces that rotation or strain across the back and through the pelvis. Now that Ashley is in this position, we're going to go through our first exercise for lumbar mobility, which we call the pelvic tilt. To do the pelvic tilt, simply tighten your abdominals or your belly, pushing your back gently down into the table, and you should feel your hips rotate up, or if you want to imagine tucking your tail down towards the table, and then relax. An option for this exercise when pregnant, if you're having some round ligament pain, is to add a towel roll under the hips, which will unload the low back and take pressure off those ligaments. The movement is the same, tightening the belly, pushing down, although you may notice a little bit more rotation of the pelvis with the space from the towel roll. You can do these exercises at any repetition. You may want to start just with 1 to 3 just to see how it feels, but typically we recommend 10 to 15 repetitions, 1 to 2 sets at a time, and you can do them 2 to 3 times per day. Again, they should not be painful, and you can always do them at a smaller distance if you're having difficulty with that movement. Our next exercise is called a lumbar rotation. To do this exercise, we're going to have Ashley bring her feet together, knees together, keeping her hands at her sides. She's just going to rock her knees from one side up and over to the other side. Any amount of distance is just fine. You can start really small, and as that feels comfortable, progress into a wider range of motion. And you can even hold a little bit at the ends for a gentle stretch. This exercise is for mobility and creates that blood flow improvement in the low back. So we do look at higher repetitions, 10 to 20 times, 2 to 3 sets, and you can do these 2 to 3 times a day as it's feeling good. Again, you can also add that towel roll under the hips if you're having that round ligament pain. The next exercise is very similar. It's just doing one leg at a time, called a hip fallout. To do this exercise, Ashley's going to keep one knee stable while the other leg drops out to the side in a controlled fashion. And again, you can do this very small, or you can do a full motion through all of your range. And then you would switch to the other side, a gentle stretch, and then back up. Again, you can do this 10 to 20 times, 2 to 3 sets, as it's feeling comfortable for you. All right, our last exercise is a cat-cow, which is going to be on all fours. So Ashley is going to demonstrate the log roll technique to get back up, so she can demonstrate that for you.
It's the same thing as we did before, just in reverse order. Scoot your hips over, roll onto your side, as one unit. Use your arms to push up while gently letting your legs come off the side of the table. To get in this position, I'm going to stand and then walk around the table to prevent any twisting when trying to get up and on my hands and knees. Come up. So this is a good exercise during all stages of pregnancy. It improves mobility and joint health. You're going to first stretch your back up like an angry cat, and then you're going to drop your belly and look up at the ceiling for cow. Stretch into angry cat. Drop your belly and look up for cow. You can do this 15 to 20 times for mobility.
We hope these exercises help elevate your health and wellness throughout your pregnancy.